Welcome to Biztech's Health and Wellness Show, where we focus on equipping you with the knowledge on health and wellness to help you to ensure a more productive and healthy life for yourselves, your families, and your employees. Now, I'm Brian Fernandez, your host, and today we're looking after your health from a holistic perspective. Now, here to bring expert insights on holistic healthcare from a very innovative company headquarters in Malaysia, we have Azran Osman Rani, co-founder of and CEO of Naluri. Now, it's a company that utilizes a multidisciplinary approach, utilizing digital solutions to deliver better outcomes. Now, Azran, welcome to the show.
Thanks for having me, Brian. Good to be here.
Now, Azran, give us an overview of Naluri and what inspired you to start this business.
Sure. Well, we are a digital chronic disease management program that aims to provide professional care in a convenient and accessible manner that delivers quantifiable, clinically significant outcomes. And if I were to think about the inspiration, probably for me, it would be looking back at how when I lost my father to diabetes and cancer 10 years ago now, at that point, the healthcare system was only focused on his physical health. And a lot of the treatments were focused on things like surgery and chemotherapy and radiotherapy and medication. But when someone is going through a battle with both diabetes and cancer, we did not understand that the importance of depression and anxiety and how that can influence his health, right? So healthcare today is very siloed. And that's why I felt there's an opportunity both to address healthcare together, especially strong correlations between chronic diseases and mental health. But how do we apply technology to make it much more convenient?
Okay, Asran, I looked at your team. You've got a very, very impressive team from a management perspective and also a very multidisciplinary healthcare team. Tell us how you assembled the team and why you did that.
Well, you know, for the first 6 months of Naluri's inception was without a single line of code being written. It was just spending a lot of time talking to everyone. And ultimately, with our core leadership team, it is not necessarily people that I know, but through common networks, right? When you reach out to people and say, this is my vision, this is my, my dream, who are people out there who both share that vision and inspiration, but also bring different skill sets and different approaches. And so, I started with me and then getting Jeremy on board and, Tiffany and Aiden and Tim were all, we brought them all together through our own networks.
Okay, I'm going to zoom out a little bit and take a macro perspective because the challenges of healthcare are global, but
Yes.
We're going to first focus just on Malaysia for a start.
Yep.
And talk us through some of the challenges with regard to chronic diseases, for healthcare inflation and economic impact of the nation and on corporations as well.
Sure. Well, first, let's start with prevalence, right? We are unfortunately Asia's most overweight and unhealthy society, where up to 50% of our adult population are obese or have diabetic levels of blood sugar, hypertensive levels of blood pressure, high cholesterol. And at the same time, between 60 to 80% of that population have elevated levels of depression, anxiety, and stress. So this is a real epidemic at a massive scale. Now, the second part is, for example, when it comes to mental health, we have 1/10 of the number of mental health care professionals that we should have for our population when compared to markets like Australia, Hong Kong, or the UK. So with only 200 plus practicing clinical psychologists and 400 plus practicing psychiatrists, we have the capacity to help about 600 to 700,000 Malaysians, ignoring between 6 to 8 million others who need help but are not getting the healthcare that they need. So simply trying to hire or train more incrementally, we're never going to move the needle unless we step back and take a radically different approach. How do we take that one psychologist, for example, and amplify their reach by over 10 times? And that's the problem statement that I set out to do.
Now, Asran, one of the key things is also in not just in a place like Malaysia, but Asian societies in general, mental health is something that's swept under the carpet, isn't it?
Yes.
And one of the things is, how have you seen elevated levels of challenges with mental health, especially with this pandemic right now and people working from home?
Yep. So for example, we quantify levels of depression, anxiety, and stress. And typically, for example, 40% of working adults across Southeast Asia have elevated levels of depression, 60% have elevated levels of anxiety, and 30% have elevated levels of stress, but at different degrees of severity. A large majority of them are still at that early, mild, moderate level, but about 7 to 20% are already at a severe level, which means their ability to work or their ability to carry out tasks at home are impaired. They can no longer function effectively. Now, in that process, comparing, for example, the last 12 months during this COVID-19 pandemic versus the 12 months of 2019, that number has jumped by over 40%. Second insight, there's a generational effect. So if we then cut the data between under 30s versus above 40s, the under 30 younger millennials are experiencing, again, between 50 to 70% higher levels of depression, anxiety, and stress than the ones who are above 40.
Okay, that's a very interesting insight, because then we don't even have the capacity to deal with that situation currently, because if you look at the healthcare systems across the region, which is very COVID focused, you're going to have all these people developing mental health challenges and depression and so forth going untreated. And that's going to have a severe impact, not only on the wellness of the population, but also impact productivity.
Yeah.
Now, I want to take I want you to help us understand also the evolution of healthcare, because the paradigm has shifted. You've got healthcare 1.0, and then you now have this holistic integrated healthcare paradigm, which is 3.0, which encompasses wellness. Walk us through how that's taken place.
Sure. Well, let's start with definitions. For us, healthcare 1.0 are physical hospitals and clinics where people who are unwell go out and get help. Healthcare 2.0 for me are the telemedicine or telehealth models, which are marketplaces, right? Where I make it much more convenient so I can book and see a doctor or a specialist. But both Healthcare 1.0 and Healthcare 2.0 have three major shortcomings. The first is that they are reactive and transactional. You wait until someone is unhealthy and you expect them to reach out. And it's transactional or episodic, meaning one consultation, one treatment, one prescription. But the problem is today's healthcare, 60 to 70% are chronic conditions. You cannot fix it with a single visit, a single consultation or prescription or treatment. You need structured ongoing care. The second shortcoming of both Healthcare 1.0 and 2.0 is that it's siloed by specialization. You see a cardiologist and she's going to talk to you about your heart. You see a gastroenterologist and he's going to talk to you about your gut. A dietitian helps you with your food. A psychologist helps you with your mental health. But again, with chronic conditions, they're deeply interrelated, right? Strong correlations between depression and diabetes, between anxiety and heart diseases. So you need a multidisciplinary approach where a team is coordinated in helping the patient at the center rather than expecting the patient to see individual specialists. And the third challenge with both Healthcare 1.0 and 2.0 is whether you are the patient paying for yourself or your payer, i.e. your insurer or your employer, is paying for a service, but not necessarily whether you get healthy, because not every prescription or treatment will actually lead to health. How do we shift the industry to an outcomes-based approach where we measure health outcomes and we want to move the payment or the economic model towards one that's based on actual health improvement? So those are the three ways that we're trying to shape Healthcare 3.0.
So Azran, and I'm going to break that down a little bit more simply so that some of our audience may be able to understand. So if we take a multidisciplinary approach, people can have in mind palliative care. So this is palliative care that's exploded. Because palliative care is basically an all-encompassing multidisciplinary approach. You look at every aspect of it and you treat that patient and help that patient to manage their illnesses. 1.0 and 2.0 is an illness paradigm. Yours is a wellness paradigm. I think that probably would sum it up a little bit
Yeah.
succinctly. Now, Asran, I want to ask you, in terms of your customer segments and your business itself, um, who do you focus on and who are some of your key customers?
Well, while we work with both payers and providers,
Okay.
the payers in the industry, i.e. insurers and employers, are the ones who are feeling the brunt of continued double-digit cost escalations in the last 5 to 10 years, right? So between 10 to 17% annual growth in premiums and medical costs. And for employers themselves, they can't just say, oh, I've got insurance for my employees, because if you don't do anything, your premiums are going to keep going up because your employees are getting healthier.
Yeah.
Plus, insurance only covers direct medical costs. It doesn't cover indirect costs like sick leave, lost productivity, absenteeism, and presenteeism, right? And that is why the largest employers from, leading oil and gas companies, airlines, banks, telcos, consumer goods companies today are reaching out for programs because they want to be able to both contain those costs, improve engagement with employees, because when employees are unwell, they become disengaged, so that they ultimately become higher performing and productive employees.
Okay, Azran, to break it down for us, what does the customer engagement look like for you? So I'm a corporation, I hire you.
Yes.
Walk us through, starting with what's the problem statement, healthcare challenges facing the organization, to your engagement with the client to determine the needs, recommendation of solutions, execution of your programs, and then the outcomes and feedback loops. Can you just kind of walk us through how that actually typically happens? And maybe you could use an actual example of how what you've actually done.
Well, Brian, there are generally two main approaches that we work with our clients. The first is a more traditional, holistic approach to address physical health and mental health together. Although about 70% of our work in the last 12 months have focused exclusively on mental health or employee assistance programs for employees who are now wrestling with depression and anxiety from the turbulence of COVID-19. But in both cases, it starts with an assessment, because we come in and we at least help our clients to establish a profile through a health screening. So we even do blood tests for employees to establish blood sugar, cholesterol profile, blood pressure, and weight, as well as we do an assessment of depression, anxiety, and stress. There alone, you can see the correlation between the two. Plus, we then look for patterns against how that has related to how much it's costing these employees, i.e. both direct medical expenses for the last 3 years, indirect costs like sick leave or productivity losses. And again, the more unhealthy you are, the more you are a cost to the organization. We then identify those who have elevated risks and a willingness to say, I want to do something about it now, right? And they enroll in our structured digital coaching program, where they're assigned their own team of psychologists and dietitians, doctors and pharmacists, exercise coaches. We even provide executive coaches and financial planners, because workplace stress and financial stress are the two biggest stress triggers that employees are facing today. This team works as one single team to help each individual employee achieve their specific health goal in a personalized manner. We then do a closing health assessment, sometimes in 4 months, sometimes at the end of 12 months, so that you can see that pre and post, and then be able to quantify the impact of health improvement, so that organizations can see the expected reductions in healthcare costs going forward.
Now, Azran, a lot of what, I think I would say some of what you're doing has actually been done since the 90s by managed care organizations.
Yes.
How are you different? Because that's the key thing when clients will be asking you.
Absolutely. And I think at the core of it is using technology, because all of that healthcare delivery is done online, number one. And two, specifically, it's done through asynchronous chat, primarily, with a lot of self-help tools, so that it's more convenient. You don't need to make any appointments. You don't need to be there at a particular time, because I've got this ongoing chat channel with my psychologist, with my dietitian, with my doctors, right? And they're assigning me different, homework, food journaling, etc. And they're tracking my progress, right? Because we also provide Bluetooth connected weighing scales, Bluetooth connected blood pressure cuffs, glucometers, etc. And therefore, we then apply artificial intelligence technologies to predict mindsets, motivations, resilience levels, so that as a healthcare professional, I need to know when is the best time to engage someone to help them become more self-sustaining. So it's not about providing everyone the same amount of care, but to be smart to allocate the precious resource of that healthcare professional to target the right person at the right time with the right message and the right approach.
Now, Azran, has the pandemic impacted the way employers look at their health and wellness of their employees?
It certainly has. Clearly, mental health has become front and center. When we first started this in 2017, 2018, there wasn't a lot of interest with mental health specifically. And in a way, diabetes and heart conditions became our Trojan horse, where we provided mental health support for those with diabetes and heart disease conditions. But today, organizations are saying we need to provide mental health support for our employees. And today, insurance companies are saying we need a data-driven approach to address mental health so that it can be translated into an actual model and we can create proper products and premiums to cover this condition, because it's not really readily available today.
So what are the key things then should employers be looking at right now to reduce their healthcare costs, increase productivity, and improve their employees' well-being?
Right. So first, I think, is to address both physical health and mental health together. For example, just simplistically, someone may be depressed, and trying to help them from a pure psychological or mental health view may not be as effective as if I also pair that with a dietitian. Interesting, because when I can engage you on making a conscious decision on what you eat 3 times a day, you're much more likely to start to feel in control of your life and be able to make decisions on other things. Because when you're feeling depressed, there's a lot of, I've almost given up and I just let things happen to me. Okay. The second part is addressing it earlier, taking a more preventive or proactive approach. So as I shared earlier, if 50% of the employees or insurance policy holders are healthy, you don't want to wait until they become unhealthy and then help. Right? You don't want to wait until someone's overwhelmed with depression and then say, okay, here's a hotline or here's a therapy session. What can we do to maintain healthy employees, their levels of resilience and their levels of physical health so that they don't become sick or ill, right? And so we've got programs to engage people to maintain positive mental health.
Now, Azran, this has been a fascinating discussion, but before we conclude this, what are the final thoughts that you could leave us with?
Well, for me, it is, where does this lead to going forward in the future, right? We've talked about how do we move from a reactive to proactive. We talked about moving from siloed to multidisciplinary. But at the end, right, the real thing that will shape or challenge this industry is moving towards outcomes-based healthcare, right? Where, the economics, pricing structures are based on actual health improvements. And that means healthcare providers, whether they're hospitals or primary care general physicians, need to be more accountable for people's health. And that means to look at health not only when they come to see the specialist, but how do we provide ongoing or continuous care when they're at home? And this is, again, where technology plays a big role, because you can provide that continuity of care in a more convenient and affordable way, but also to be very quantitative so that we can actually truly build predictive economic models. We can truly change the way insurance products are created and priced that is much more personalized to people's health. Because today, most of us are paying a standard premium, whether you are a super cyclist like you, Brian, or someone who is not, right, are paying the same health insurance. That's got to change, right?
Yes, absolutely. Azran, thank you very much for taking the time to be on your show. I've certainly learned a lot. I'm Brian Fernandez, and I've been speaking to Azran Osman Rani, co-founder and CEO of Naluri, on Biztech's Health and Wellness Show. This video will be on our Facebook and LinkedIn sites, as well as our website, www.biztech.asia. Please like or subscribe to our various platforms. Thanks a lot for tuning in.